Hello, my name is Krista Mukmuku and welcome to my antenatal palpation video. This is Miriama and she's 38 weeks gestation. This is her first pregnancy and she's expecting a boy. I have been caring for her throughout her whole pregnancy. Hi Miriama, how are you feeling today? Perfect. Have you been experiencing any pain lately? Great. So today I will be feeling your stomach to see where baby is laying. I'll also be measuring your fundal height and taking baby's fetal heart rate to see how we are progressing. Now, before I begin the palpation, would you like to go to the bathroom and relieve your bladder, as it may be uncomfortable while I'm palpating? Miriama has passed urine and she's now laying in a comfortable position on the bed with a pillow behind her head and her shoulders, and her knees are slightly bent. Now, Miriama, is it okay if I palpate you to see where baby is lying? Great. Now, is it okay if I just pull the sheet back and lift up your shirt slightly? Perfect. Now, at any point during this palpation, if you feel any pain or discomfort, let me know straight away and I'll stop immediately. Okay, so before I began my palpation, Miriama has asked me a few questions. The first one was about linea nigra, the dark line underneath the belly. So, Miriama, the dark line underneath your belly button is called linea nigra. This is very common during pregnancies and it is due to an increased level of hormones, and it typically goes away after birth. Miriama has also asked me about itchiness that she's experiencing on her stomach. Now, Miriama, this itchiness you're experiencing is due to the drastic change your body is going through from the growth of your baby during this pregnancy. It is very common and you can relieve it by drinking some water or using creams such as bio oil. This itchiness could also later on lead to some stretch marks, which later fade into a light white scar. Now, both these things that you are experiencing are completely normal and common during pregnancies, so there is nothing to be worried about. So I have washed my hands and I have warmed them up to make it as comfortable as possible for Miriama. Wow, Miriama, you look great for a woman of your gestation. Now, is it okay for me to begin palpating? Perfect. So first I'm going to be finding your fundus. Perfect. Now I'm just going to walk my hands down your side and back up. Great. So Miriama, where are you feeling most of baby's movements? On your left? Great. So that is because baby's bum is up towards your fundus and baby's head is towards your cervix. And your baby's back is against your right side, so his arms and legs are towards your left, which is why you feel most of your movements on your left side. Now I'm going to find your descent now, which can be quite uncomfortable. So would you be able to take a deep breath in for me, please? And relax. Perfect. So your baby's head is engaged and in the pelvis, which is great for 38 weeks. So through palpating Miriama, I found that the lie of her baby is longitudinal, his presentation is cephalic, and his position is right occiput lateral, ROL. The descent is 3/5 palpable, so his head is engaged, and the fetal movements are in a normal pattern, and the liquor volume is adequate. Miriama, is it okay if I take your fundal height now? Perfect. Would it be possible for you to please find your pubic bone for me? Great. I'm just going to take the measurement now. Perfect. So that is 37 centimeters. So that is a 1 centimeter increase from last week, which shows that your baby is progressing. Now, Miriama, is it okay if I take baby's fetal heart rate for 1 minute using this pinard? Great. I'm just going to feel for baby's shoulder. Great. Great. So baby's heart rate is 145 beats per minute, which is within the normal range, and the normal range is 110 to 160 beats per minute. Thank you, Miriama, for coming in for your 38-week antenatal assessment. I'll just pull your shirt down and pull the sheet up for your privacy. Do you need a hand sitting up? Perfect. So I'll see you next week for your 39-week antenatal assessment. Thank you for watching my antenatal palpation video.